not where they're like totally flattening their lumbar spine in that posterior pelvic tilt, or totally in that anterior tilt for that super lordotic posture. It's a happy medium. So it's a really hard skill to teach certain patients how to do. And I know you guys haven't gone over it yet in any of your classes, right? Okay, so when we're thinking about your ASIS, and you guys can do it on yourselves, that can also help. So if you palpate your ASIS and your PSIS, when you're in the neutral spine, they should be pretty level. So when you're having the patient learn how to do it, it's good to have them palpate it as well so that they can feel. And you can teach them by going to the extremes of the motion. So you can tell them, and you'll learn it's like a bucket. So tilting out the water is that anterior tilt. So as if you were trying to tilt out water that you had in a bucket, anterior tilt. Go as far as you can. That's your end range. Going the opposite way, you're gonna flatten out your back as much as you can, and that's your posterior tilt. Try to find your happy medium where your ASIS and PSIS are pretty level. That's a neutral spine. So as you're watching this, you need to be able to visualize where ASIS, PSIS are. You don't necessarily need to expose that far down, but if you need to, if you're not sure, you can palpate on them where they're at. They should be able to maintain it. So once they go into that lifting their leg, they might automatically go into anterior tilt as a compensation. So that's automatically like they're not able to achieve that neutral spine. Same thing, when they raise their arm up, they might posteriorly tilt to maintain that strength that they have. So it's really important to understand what's going on at the pelvis. So practice it with your partners before you actually get into the position.